Kermit the Frog is famous for saying it ain't easy being green. This episode is all about Lissamine green. Vital dyes are a critical part of our optometric examination. For most of us, we tend to turn to fluorescein on a pretty regular basis, but over the last couple of years, we've seen that Lissamine green and rose bengal have seemed to kind of fade away from most practices' daily examinations. Lissamine green is typically supplied at a 1% concentration. It's a synthetically produced organic dye and has been used for years in food products. Lissamine green stains dead or degenerative cells, and although they do the same thing, we tend to avoid rose bengal in our practices because it stings upon insertion. Although Lissamine green can stain the cornea, we reserve it primarily in our practices to view the conjunctiva, and then we use sodium fluorescein instead to view the cornea. When we instill Lissamine green, we typically like to observe it within the first 1 to 2 minutes. And we use it most often for dry eye disease, but recently we've really begun to use it for lid margins and in looking at conditions that we're going to review a little more in depth in Clinical Insights episode number 4, and that's lid wiper epitheliopathy. First, we look to see if Lissamine green has stained the bulbar conjunctiva. In this case here, the patient is asymptomatic and happy with their contact lenses. If we didn't utilize the dye, we would have missed the dead or degenerative cells that you see here. This would be the type of patients that we're going to move in our practices into another type of lens or possibly switch their solution, even though they're not reporting any problems. It's our clinical opinion that if left untreated, this type of problem may become more symptomatic for the patient, and thus we like to take a more proactive approach. Next, we look at the lid margins at an area called Mark's line. It's believed to be the site of contact between the eyelid and the bulbar conjunctiva. We've observed that patients with increased issues of dry eye tend to have a wider area of staining at Mark's line, and this is best observed with Lissamine. We grade this area of staining as mild if it's just a faint line, moderate, which is a wider line but does not cover any of meibomian glands, and severe when the Lissamine green has stained over a portion or even all of the meibomian glands. Lissamine green's an incredible tool, and in our practices, it's helped us differentiate and diagnose things that we'd otherwise have missed. Finding novel tools is a great way to help our patients, and helping patients is ultimately why we do what we do. We hope this has been clinically insightful.